Yeah, let me thank everybody for being here today. This is a very important issue. And most importantly, I want to thank my colleagues who are here today from the Senate, from the Assembly, from different walks of political life, Democrats and Republicans, different aisles, and appreciate the bipartisan support for an important piece of legislation to drill down and convince our colleagues in leadership in both the Senate and the Assembly and all of our colleagues to bring this bill out to the floor or in some way create an outside, independent, bipartisan commission of individuals who have subpoena power to really get the answers hundreds of thousands of friends, families, and loved ones are asking in relationship to the loss of their loved ones in our nursing homes and adult care facilities. And most importantly, probably, because you really can't come to those answers. I appreciate what the DOH did with theirs. I appreciate the hearings, but you really need the numbers. You really need the real numbers. We have to know how many individuals who are compromised, the most compromised, who this COVID virus mostly attacks. They can be fairly healthy, but if there's an underlying health concern, that's a very big problem, and that's what was taking place. So we really need the numbers in nursing homes, those who left nursing homes, went to hospitals, and lost their lives there. So thank you so much to my colleagues here who are supporting this bill, sponsoring this bill, and our leader, Assemblyman Kim, who is the lead sponsor in the New York State Assembly. Most importantly today, I want to thank a voice that is not going to be stopped and is doing wonderful work in our community, using what we call the bully pulpit here. That's when you don't have enough votes to pass something on the floor with your conference. You use the bully pulpit, and sometimes you bring the facts out, and the facts are so powerful that things begin to happen. And we have someone here, Janice Dean, who is bringing the facts out with a very strong voice, and not only impacting New York State and the need for this investigation here, but I think across the nation right now. And our condolences, first and foremost, go out to you and your family for the loss of your beloved in-laws. I know your husband is here, Sean, who was a first responder with the firefighters and was at 9/11, and your sister-in-law, Donna, is here also. So we thank you for your support. But Janice, we wish you could have testified at the so-called real hearings of the legislature, but we're so proud and thankful. Your testimony this past Monday with our conference was compelling and really got the message across. And I guess we can't call you the official spokesperson for hundreds and thousands of loved ones and family members, the official spokesperson, but we can call you the unofficial spokesperson for New York for all those individuals, because you have done a dynamic job in getting the message out and reflective of the emotional aspect of it as well as the law. So thank you so much for that. You know, I've been a legislator for a while now, been to many press conferences, as I know most of the media has. And, you know, it's not a rarity to have elected officials from both sides of the aisle supporting a piece of legislation or a concept. But it always illustrates that it has reached a level that goes beyond political affiliations and political philosophies and impacts us, whether we're Democrats or Republicans, all of our constituents. And I think this concern, as the fall weather begins to come up, we're going to have the fall, it's going to get colder, has reached that level. It reached above politics. And I want to thank, first of all, in a sincere way, Assemblyman Ron Kim here for embracing this particular bill and show my respects to him and my condolences for the loss of your uncle, because you know the emotional impact and the loss and how it feels. And Assemblyman Kim, I saw you at those hearings that we weren't allowed to speak at, couldn't speak at. And you asked all the cogent, important questions. You got none, as I saw, or very little of the right answers. In fact, you and many of us got none of the answers, got no answers to those questions. And we truly need those answers, but I respect you and appreciate you for asking those questions and not backing down and being compelled to support this bill. I want to thank your cohort, Angelo Santa Barbara, for also a majority member in the New York State Assembly for sponsoring and supporting this bill and listening to your constituents. And I also especially want to say thanks to my entire conference, my leader, Senator Rob Ort, Senator Griffo. Where's he now? Oh, in the back. You're vertically challenged like me. Don't stand behind the sign. For representing our minority leader, Senator Ort, and for the work you've done in terms of bringing this to the forefront and listening to your constituents. Senator Serino, you've been a dynamo on this. I don't have to say much about what you've been doing. You're working on those PPEs trying to get the right answer, because there are a lot of other components about this. This investigation wants to delve into that also, wants to delve into the regulations, wants to delve into the oversight. We want the reasons why the actions that took place caused this wildfire of the loss of life. But before this pandemic took place, we had problems in nursing homes. Ask any one of my colleagues. Bed sores on people, not getting the nutrition, not getting attention, have to making call after call after call to get somebody to come into the room. And we made calls after calls to the DOH, and not much of a response then. We need a real response now. And I also want to thank Assemblyman Mary Beth Walsh and Senator Daphne Jordan, who represents close to parts of my district. And the work you've been doing has been unbelievable, calling for the hearings, calling for this particular investigation, sponsoring the legislation itself. So Mary Beth, Assemblyman Mary Beth Walsh, and Senator Daphne Jordan, thank you so much. 5 months has been a long time. It seems like 200 years for most of us, I think. This COVID virus has affected individuals, families. It's affected our first responders. It's affected our nurses, our doctors. But the one good thing about this virus, it has shown something about New Yorkers. It has shown about the resiliency they have, the care and concern they have, not only for themselves and their families, because if you notice, we're talking about, they're talking about, and they're saying why they're following the CDC guidelines, staying isolated for those months, and respecting the distancing for those months, and not just to protect their families, but to protect their neighbors and others. And they realize that this is a very contagious disease. It's not to be laughed at or taken for granted. And what can we say about the first responders? Unbelievable. While we were social distancing, trying to stay away from others who could give us it, they were not. They were putting their hands on individuals who had the contagion. Most of them were one safety set of gloves and one face mask away from getting the contagion themselves and bringing it home to their families. And many of them did and have. But they were there to save lives, and they did save many. And look, we've beaten this back to a certain extent. We're not out of the woods yet, but we have beaten it back. But one area where we significantly have failed, and it's such a significant failure that we cannot allow to have it happen again. That's why this independent investigation, nonpartisan, with subpoena power is so very, very much important. We have to get the best realistic answers to why this happened and how we're going to stop it from happening, because this is a moving target, the COVID virus. Remember way back when it started, it was the truth. I remember the governor saying, look, it's more about fear, and everybody was saying it, that who were the big leadership. It's more about fear than a danger to us right now. We're going to be able to control it. And then all of the leaders began to realize that was not going to be the case, that it was not just about fear. And I heard that over and over again until it really started to expand. Remember when children couldn't get it, okay? Don't worry about children. Well, we know they can get it. Well, it's anti-symptomatic for them. Well, this Kawasaki thing is pretty serious if you get it. It doesn't happen all the time, pretty serious. Well, they can't pass it on to others. Well, yeah, we know they can now. And the antibodies, once we all get it and we get the antibodies, we're safe, and everybody else is, no. Now the antibodies don't stay for a lifetime potentially. We don't know how long they stay. You couldn't get it again? now you can get it again. It's a moving target. We don't know. They talk about the fall, what happens with the cold weather. I don't know what happens. It's a different virus than many others, but sometimes viruses change. So we have to, the important part of what this investigation is all about, and look, when DOH did that investigation, and they came out and they absolved the governor on that March 25th directive to put those who would not be tested, and if they did have COVID, that would go into nursing homes anyway. When they said that, well, we've understood when the peak amount of deaths took place, that was impossible. You know why that was impossible? Because after March, a couple weeks, they stopped counting individuals who left the nursing homes, went to hospitals, and died there. They don't know when the peak was. We don't know how many left after the 25th to a hospital and died in a hospital. We don't know when the peak is. And that's important, to know who, when, and where these lives were taken from this particular virus. The nursing home, the DOH couldn't have possibly given us that because they don't have the numbers. We've asked for the numbers over and over again, and they don't have the real numbers. The real numbers matter. And many of those individuals who went to those nursing homes were sick and then went to the hospitals had notices of do not resuscitate. And so we have to figure out exactly how many really lost their lives because of the actions that were taken. And lastly, but really not lastly, probably one of the most significant and important things, we need closure. We need closure for the people who lost those family members, and they deserve the answers because there's several disconnects that take place here. I talked about visitors on March 12th can't go into nursing homes, family members, even with CDC guidelines. Then 2 weeks later, people with the contagion can go in. But then the governor over and over and over again in the ensuing week said, I was forced to put them in the nursing homes. It was a CDC guidelines. Then he got to the point where he said, well, it really didn't matter because you know whose fault it was? It was the staff's fault. No, I think probably the staff had something to do with it. But to suggest that putting those who had the contagion in had nothing to do with it. And then, and this is the disconnect, after saying over and over, had nothing to do with it. May 10th, what happened on May 10th? Reversed himself. Everybody has to be tested to go into a nursing home. If you have the COVID virus, we really can't let you go into a nursing home. Now, if he really believed it was the case, that putting COVID contagious individuals into the nursing home didn't spread the disease, why would he basically repeal the 25th directive and say, you have to be tested and you can't go into a nursing home? These are questions which need to be answered. We'd like to have some of the professionals who were subpoenaed in the field of healthcare be interviewed, and we'd like to look at the timelines. And I truly don't understand. They were able to do what they called a holistic study to absolve the governor to say that it was those who worked in nursing homes which caused this. But they never had the number of how many people, individuals, actually died. How is that possible? You could take the time to do a full investigation and absolve the governor by his 25th of March directive, but you never could figure out the number of nursing home patients. And to this day, they say, well, the pandemic's still going on. Well, the pandemic was still going on when they were doing the investigation also. So without those numbers, you have to take that with a grain of salt. The hearings were fine, but they weren't answering Assemblyman Kim's questions or anybody else's questions that were asking questions. So at this time, I'd like to bring up Senator Griffo, first of all, who's going to be speaking on behalf of our minority leader and our conference. And thank you so much for your work, Senator. I'm going to have this.
Well, thank you, Senator Tedesco. Thank all of you for being here today. I want to thank Janice and her family for being here. Again, our condolences to you for your loss and also to Assemblyman Kim for his loss. And I think this representation today of this bipartisan group of legislators, I think, indicates the significance and importance of this issue. I particularly want to signal out Senator Serino for her very passionate activity and work on this issue as our chair in aging, and Senator Jordan, who's joined her in trying to ensure that the issue continues to be in the forefront because it legitimately has to be so. And my colleagues in the Assembly, Assemblywoman Walsh and Assemblyman Santa Barbara, thank you all for being here today. I'm pleased to be here on behalf of Senate Minority Leader Rob Ortt to show the commitment from the leader in this conference to this issue. Because this is an issue, in my opinion, about respect for human beings. This is an issue that should demonstrate that we have empathy and that we feel emotion. This is an issue that really requires, and it's evidenced here by the presence of these individuals, bipartisan support for this legislation to conduct a legitimate, objective investigation regarding state directives for nursing homes and similar facilities during the coronavirus pandemic. The call for action and attention to this issue is legitimate. It is not motivated by politics. It's motivated for people because there's a care and a concern about people and their lives. So they deserve answers. They deserve all of us to continue to keep working to ensure that they get answers. And it's not about pointing fingers. It's about accountability. I think to have a department issue a report is reasonable, but to have that department investigate itself is ridiculous. So the action that we are proposing and advocating as a result of the hearings and the roundtables that have been conducted, I think will help us all to focus on this issue, to take into account what has happened so that we can take action in the future to prevent this from happening again, and that we have proper plans ready and in place to deal with the continued challenges of COVID-19. We hear from so many constituents across the state, families who are nursing home residents who've raised legitimate, valid concerns about the care that their loved ones are receiving and have received in nursing homes. This is an opportunity for us not only to have accountability from a state perspective, which we have to do as officers of the government, but it's also an opportunity for industry-wide reform. And I think we take these complaints seriously, and we have to take actions as we move forward to address these issues. We must have a more aggressive ombudsman program and funding it appropriately to ensure that there are eyes in these facilities. If the state can investigate bars and restaurants under this COVID-19, how can we not investigate some of the nursing home conditions and the concerns that have been expressed by residents and families? If visitors and prisoners can engage in a short embrace at the beginning and ending of each visit at a New York State correctional facility, how can we not let the same be done in nursing homes between families and their loved ones? We talk about the need, the social, emotional need of students. Well, what about the elderly and that connectivity with their family? So as a state, we need to be held accountable, and we need to do better. But we can't stop here. We need, again, not only support for this legislation and this type of investigation so we can learn and prevent this from happening, but we also have to urge and continue to advocate for dramatic, substantive, and immediate changes industry-wide. This is an industry that costs so much, but has given so little, and yet the need is great. So enough is enough. The voices here today need to be heard. The stories that they tell need to resonate. And as a result, I hope that we will have that accountability, answering these questions to prevent this from happening again, and also an opportunity to begin a dialogue and plans to change and reform the industry. Thank you.
The only reason this bipartisan concept is a bipartisan bill is because Assemblyman Kim was willing to rise above politics and said, yep, it's affecting all of us from every party, from every affiliation, and we've got to collectively do something about it. So thank you much, Assemblyman Kim, and we'd like to have you come up and speak. Thank you for support.
Thank you. I can't recall the last time we had a bipartisan press conference or an effort like this. So I want to thank my colleagues on the other aisle for bringing us together. And Senator Tedisco and your staff, when you first reached out to me with this legislation that your staff had drafted, Of course, initially, you're like, oh, is this going to be politicized, or is this going to? But after speaking to your staff and yourself directly, it was very clear that you're doing this for the right reasons, and your colleagues as well are in it for the right reasons here. And you can tell by the questions that you asked in the hearings that we had in the last couple of weeks, and your dedication to getting to the truth. And that's why we're here, to get to the truth about nursing homes. Now, we've been given some facts by the governor, but in order to get to the truth, and there's always just one truth behind everything that we do, we need the rest of the facts, and that have not been presented to us. How can we possibly know, what caused the spread, and what was the root of the problem if we only have a quarter of the sample size of people who are infected? We need everything, and the governor knows that, and this administration knows that. And instead of sharing all that information, instead of being self-accountable, I think they are more concerned about reducing any criticism into partisan attacks and blaming others instead of being fully accountable of what happened for the last 5 months. And again, I'm not here to demonize or vilify the governor. I asked some of our witnesses on Monday whether they'd be willing to even forgive him if he's truthful and be willing to admit there were mistakes made so we can move forward in the right direction. And everyone agrees that we're willing to work with them if we can get to the truth. And I want to just take also a moment for Janice Dean. I know, we've heard your stories, and I personally, I was in my car on Monday with my wife driving in Queens, and we're listening in to your first testimony, and my wife was in tears just listening to your story, because she's also seen the pain and trauma that my family has been going through, as well as the endless stories that we've been hearing from other people around the country. And you, in that testimony, represented so well of the deep pain and trauma that tens and tens of thousands of people are going through as we speak. So thank you for doing what you're doing, and your family for being here as well. And that's the point that I think we're trying to establish here today. Instead of going to the CEOs, the shareholders, the board directors, the businesses behind these places, we should have went to the families. We should have went to the residents. We should have went to the workers, the frontline heroes who are seeing everything from day one. All the understaffed, all the under-resourced conditions of the nursing homes, they clearly saw it, but instead of going them to co-design our solutions and co-create policies that can truly work to protect the rights of residents, we went the other way. We went to give them a blanket pass. Why would you give them a blanket pass, giving full immunity for transferring patients if you thought that sending 6,500 COVID positives was okay? Why would you give them a get-out-of-jail-free card for doing that if you thought that that had no impact, that it was the workers and families that spread the COVID-19? I mean, all those questions can only be answered at this point by an independent, nonpartisan commission that can get to the truth. And Angela and I and my colleagues in the Assembly are willing to push this to make sure that we can get to the truth so we can move forward in the right direction. Thank you.
Thank you, Assemblyman. When tragedy strikes individuals, and it struck a lot of individuals in relationship to this issue, sometimes you just recoil. Sometimes you're just so depressed. Sometimes you just don't know what to do. You strike out. Other people take their own personal tragedy and turn it into something so positive that it impacts others' lives, and turn their loss into something extremely positive. And that's the lady right there who has done that. Made a profound difference now. And she's not done yet. I'm pretty sure about that. She's dedicated towards this. Taking her own personal tragedy, her family's personal tragedy, and said, come on along with me. We got to stand up. We have to make a difference. We got to find out why this happened. We got to stop it from ever happening again, as a tribute to her loved ones and to all the other loved ones that lost their lives. And we can do that. We can do it better. We have to figure out what we did wrong and not do that, but we can even do what we did better. And Janice Dean is the one that's leading us in that right now. And God bless you, Janice, and come on up. We really appreciate everything you've done.
Your words moved me today. Assemblyman Kim, I thank you for being here. You are the reason this is a bipartisan bill. Thank you all for being here today. Thank you to my family, my husband, and my sister-in-law for being here. I am the meteorologist. I'm used to forecasting storms. I'm not used to being in one. I've always said the only red and blue I see on a map is areas of high pressure and low pressure. And the same is today. It shouldn't matter who I voted for or who I work for. I was affected by this. Both my father-in-law, Mickey, died of COVID in a nursing home, and my mother-in-law, Dee, died in an assisted living facility 2 weeks apart from each other. I didn't know I would ever be in this position, but when I started listening to the news reports and not hearing the questions being asked, I felt it was important to, because I have a platform, to start raising those questions on my own. And I'm grateful for the place that I work for allowing me to do that. And also in meeting the families and talking to the families. I don't know who they voted for. I don't know what their politics are. But we share the grief and the anger sometimes in not getting the questions answered. So thank you for letting me talk this week. Some people might have been nervous or said they felt uncomfortable with my testimony, but I spoke from the heart and I spoke from experience, and I spoke from as a grieving wife. And to see all of you today, Assemblyman Kim, senators, wanting answers for my family and the people that I am speaking for today. It's my honor to be here, and I'm looking forward to hearing those answers and to being able to feel that my grieving is important and it will lead us somewhere. And as I mentioned about the storms, this morning when we were driving to Albany, we saw a rainbow. A perfect rainbow. And I looked at my sister-in-law and my husband and I said, that's Mickey and Dee. And they're proud of us today. So thank you, thank you, thank you, thank you.
Thank you, Janice. I'd like to have Senator Jordan come up now, if you could, say a few words.
Thank you, Senator Tedisco. I'm proud to be standing here with you and my colleagues on this issue. And we appreciate your tenacious leadership on this critically important issue and for advancing this very necessary bill. I also want to applaud Janice Dean for her tireless, powerful, and principled advocacy in demanding accountability. Thank you. We're very sorry for your loss, for your family's loss, and we're honored here to be standing beside you today. Your perspective and your voice, which deserve to be heard, should never have been attempted to be silenced. It's so important what you have to say in informing the issue and informing the policymakers. I also want to applaud Democrat Assemblyman Ron Kim for being here and sponsoring this essential measure in the Assembly, showing that this really is a true bipartisan effort. We're here as part of an ongoing, growing effort to seek answers and demand accountability. The preventable deaths of 6,400 senior citizens due to the governor and State Department of Health's reckless, irresponsible, and deadly mandate that forced nursing homes to accept COVID-19 positive patients is a staggering incomprehensible loss for the families in my Senate district and around the state. That's over 6,400 lives, and possibly double that amount that have been lost. And we still don't have the full, painful picture. Many families in my district and across the state are shattered and grieving. Our hearts go out to those families who lost a loved one because of the state's disastrous policy. What's especially troubling is that the Department of Health and public health authorities knew and were informed at the very beginning that the elderly and those of frail health were among the most at risk of COVID-19. Why and how could the decision be possibly made to bring the virus to their place of residence and care? It defies logic, reason, and plain good old common sense. Without question, the continued search for answers demands this common sense legislation that would create a bipartisan state commission to investigate New York's COVID-19 nursing home response and tragic deaths that took place. The commission would be empowered and expected to follow the truth wherever it leads and whomever it implicates, regardless of their power or position. The first responsibility of government is to secure safety and health for their citizens. On that account, for our nursing homes and the senior citizens who reside there, New York State failed miserably. The bill must pass before session ends, and it must become law so that we can ensure that the preventable tragedy that befell some of our most vulnerable citizens never happens again. I'm so proud to co-sponsor this bill and continue working with my colleagues to ensure its passage. Thank you very much. Okay.
Thank you, Senator. I can tell you, and I know that Senator Serino has been working on nursing home issues for weeks now, brought it to our conference. We had a lot of discussions because of her concerns in a lot of areas. I'd like to have her come up now and say a few words.
Thank you, Senator Tedisco. And I'd like to say a huge thank you to all of the media that's here today for getting this story out. It's so important. You know, you've heard me say our elderly, our seniors didn't have a choice or a voice. But today, we have Janice, Sean, Donna, Assemblymember Ron Kim. You are their voice today. Thank you so much from the bottom of my heart. You know, at the round table, our conference held on Monday, we heard from Joanne Miles Thomas, the stepdaughter of a veteran isolated in a New York nursing home. She testified that her stepfather says something that really bears repeating. There's no pride when lives are lost. Yesterday, I was absolutely speechless when news broke that in the middle of a pandemic where lives are still being lost every single day, our governor is going to be publishing a book painting New York as the ultimate COVID success story. Unless the proceeds of that book are going to be used to fund an independent investigation, makes sense, right? Or compensate victims' families, or pay the funeral expenses of the thousands who passed in these facilities, I cannot think of a bigger slap in the face to these victims and their loved ones. As the ranking member of the Senate's Aging Committee, I went to both joint hearings with an open mind and a genuine desire to improve the state's response to the crisis in these facilities. While we heard some powerful testimony, what we got from the Department of Health and the executive was nothing more than a repeat of the state's basic talking points. When legislative leaders had a chance to take a deep dive, issue subpoenas, and help get answers New Yorkers deserve from the state, they chose not to. Though, through its inaction, the legislature has been complicit in allowing bad state policy to put the most vulnerable in harm's way. Now, more than ever, we need a truly independent, nonpartisan investigation into the state's mishandling of the crisis in these facilities, and subpoena power is key. They have it. This is not about assigning blame. In fact, I think most of us here in this room today can agree that the governor did a great job when this pandemic first hit us. It's not about blame. It's about finding answers. Without these answers, without knowing how many people we truly lost in these facilities, without knowing how key decisions were made by the state, we are limited in the changes we can effectively make to help save lives. These families, these victims deserve better. In a press release on the governor's new book, we're told he writes, "If you don't feel fear, you don't appreciate the consequences of the circumstance." After sitting through almost 30 hours of testimony, I am certain these residents felt fear the minute they realized they were absolutely defenseless against this virus. I am sure they felt fear the first time they saw their favorite aide with no PPE, or saw a COVID-positive patient being sent directly into their home, their room. They most certainly felt fear when they started to show symptoms themselves. And I know they felt fear when they realized they were dying, isolated from those they loved the most. These residents, their loved ones, and those who care for them appreciate the consequences of the circumstance better than anyone. They deserve answers, they deserve accountability, and most importantly, they deserve a better path forward, and we are not going to stop fighting for it. Thank you. Thank you. Oops.
Thank you, Senator. You know, I think we've got some momentum. I think what we're saying makes eminent sense. And now we've got two majority sponsors in the New York State Assembly. And I'm hopeful that the circulation will take place and we'll get more sponsors and build it up. But I appreciate Angelo Santa Barbara, one of our Assembly members from Schenectady County and other counties, is supporting this. He's speaking up for his constituents and asking the questions, and that's important. We got to keep asking those questions, and this is the way to get the answer. So thank you for the support and for the sponsorship today. Come on up, Angelo.
Thank you, Senator Tedisco. Janice, my condolences to you and your family. My colleague, Assemblymember Kim, my condolences for your loss as well. And to everyone that's lost a loved one due to COVID-19, my condolences. And as you heard, a lot's been said already. This is a bipartisan issue. We see legislators on both sides of the aisle here calling for this investigation. And it's not something that just started. We've been calling for an investigation way as far back as April. In most regions now, I know in the Capital District, in my district, they're well into the reopening process. And an investigation is long overdue, and it's so critically important to ensure that we can make the necessary changes to prevent tragedies like this from ever happening again. That's what this is really about. We owe it to the people of this state to get the answers and determine what happened, both as a means to hold people accountable, but as well as to learn what worked and what didn't work. And that's important in preparation for the next public health crisis, should it arise. Health officials and providers all agree that an investigation is long overdue. So if the governor's not going to do it, then we as legislators must pass the necessary legislation to review and investigate New York's policies, to review the decisions, the protocols that were utilized in response to COVID-19, and how they impacted state-regulated nursing home facilities. So the question for today is an investigation warranted? And it's undeniably yes. This legislation is needed at this point, and it does need to be passed before this session ends. And as you heard, although thousands of elderly New Yorkers died in nursing homes amid the pandemic, there are serious concerns that that number could be even higher. The new reports that have come out talk about significant undercounting of nursing home deaths, and we're left with far too many unanswered questions. And as was described earlier by Senator Tedesco, unlike other states with major outbreaks, New York has only counted residents who died on nursing home property, not those who were transported to hospitals. That is one of the biggest concerns, and from the hearings, that's what was brought to light. New York seems to be one of the only states that does this, counting those deaths separately during the pandemic. So simply put, to make our nursing homes safer, we need to know the real numbers, including how many nursing home residents died at hospitals in connection to the crisis. We also need to know which nursing homes had higher rates of infections and deaths. An independent investigation can provide this important information on the state's response to COVID-19 in nursing homes. And that data will be key to knowing what was done right and also what was done wrong, and the impact of the state's policies and facility practices. We can then better identify statewide and regional rates of infection, hospitalization, recovery, mortality rates, and determine all the factors that contributed. And we need to determine which policies impacted nursing homes in the state the most. And most importantly, identify ways to improve and eliminate the policies that contributed to nursing home deaths. The fact is, even after reversing the decision in May with an executive order forbidding hospitals to discharge patients to nursing homes unless they had tested negative for the virus, we are still waiting for answers from the governor's office. With New York's coronavirus death toll in nursing homes among the highest in the nation, these families deserve answers. It's long overdue. And if a second wave of the virus does hit, we need to have a comprehensive response in place. Getting that data is critically important. This independent investigation is necessary for the families that have lost loved ones, for the caregivers who put themselves at risk, and to ensure better and safer policies moving forward. And I had talked to Senator Tedesco's office, Assemblyman Kim's office, and I immediately co-sponsored this bill. This is something that people are looking for. We owe it to the people of this state to make sure this bill passes, that we get the answers that we need. And again, these families deserve answers, but we need to be prepared should this happen again. And we need to know that we have done all that we can to protect residents in nursing homes. Thank you to all of my colleagues for being here today. Thank you to Assemblyman Kim and Senator Tedisco.
Thank you, Assemblyman. In 2016, after a few terms in the Assembly, Senator Hugh Farley, who was the senator at that time, retired. So they asked me to run for the Senate, and fortunately or unfortunately, I did. And when I ran for the New York State Senate, I was in the 112th Assembly District. And that young lady over there ran for my seat in the 112th Assembly District. And when she got elected, I said, well, you got the new and improved version of an assemblyman for the 112th Assembly District, because she has done an unbelievable job in the New York State Assembly. In fact, she's moved up so fast, she's the assistant to the floor leader on there and leads a lot of the debates on there. And I'm very hopeful you'll be leading a debate on this, and it won't go too long and maybe pass unanimously, but she's a sponsor of this bill. She's been speaking out, asking the same questions her constituents, our constituents have been asking, and we've all been asking. And she's helping us all now move it forward and maybe get the answers to that. So, Assemblywoman, come on up and speak. Thank you.
So good morning, everybody. I'm so glad you're here. I didn't even know if I would be speaking today. I didn't bring any really prepared comments. And my colleagues on both sides of the aisle have done a beautiful job really explaining why I'm such a proud co-sponsor of this legislation and why I think it's necessary. So I won't say too much, but I am finishing up my 4th year in the Assembly, and you know, there's a lot that happens in Albany that maybe some of us shouldn't be too proud of, but I'm really proud to be here today. I feel like the reason I'm proud to be here is because I think it's the right thing to do. And, you know, the fact that it's bipartisan, the fact that we're here just asking the questions that need to be asked, asking to put in place a thoughtful study of why this happened and to try to give not only my constituents, but the people of the state answers. You know, I thank Janice Dean and her family for being here today and lending your voice and your advocacy to this. You know, when I heard that the governor was publishing this book, right, which is going to give people lessons in leadership, I just think that it's to be a good leader needs to be willing and to have the humility to step back and to say, what have I done right? What have I done wrong? what has gone right and wrong, and what lessons can we learn? It's something that we all do, as whether we're legislators or whatever walk of life we're from. We have to be willing to thoughtfully examine what happened and to learn the lessons that need to be learned so that when the fall comes, when the winter comes, if there's a resurgence, whatever the future holds, we have the information that we need in order to move forward in the best way possible. So I am a proud co-sponsor of this. I thank my colleagues for being here today. I especially thank Senator Tedisco, not only for deciding to run for the Senate, I'm so glad he did, but also for inviting me here today. So I do hope that we have an opportunity to have this come to the floor for a vote. I would expect that it would pass, if not unanimously, very close in our House if it's allowed to come to the floor, and I hope it does. Thank you.
Thank you, Assemblywoman. Well, Mary Beth mentioned it, so I'll have to just follow up on it a little bit. I said earlier that Commissioner Zucker and DOH did a full-blown study, they said, and they found out the real reason why this wildfire took place, and it wasn't because of the March 25th directive and putting those who had the contagion in a nursing home. They had time to do that, but they didn't have time because the pandemic is still ongoing to get the real numbers, those who died in nursing homes, those who went to hospitals. And as Mary Beth mentioned, I don't know how the governor had time to write this book, but I do think before he ever put pencil to paper, that he would have finished writing all the letters of apology to the family members and the loved ones who lost lives from their family members in this coronavirus. I'd like to see those letters go out in terms of apologies before I see a book take place about leadership in the pandemic. I'm not blaming him for everything that took place, but as Mary Beth said, the buck stops at some place, and we gave him a lot of authority. In fact, he was in full control, and during the course of this thing said, hey, if you want to blame somebody, blame me. And right now, I could probably mention more individuals to you that he did not blame for that 25th directive than the ones he did blame for it. So I'm a little bit concerned about using the excuse that the pandemic virus is still going on. For that reason, we can't really find the real numbers. We should have the real numbers. We have the expertise to do that. We have the people in the Department of Health, and it's a concern that we don't have those, and that's why we definitely need this independent investigation to make that happen, get those numbers. Any questions you'd like to ask anyone?
First, my condolences to those who've lost loved ones. And this is for Assemblyman Kim, but I do have a follow-up question, so if I could just ask my colleagues to allow me to ask a quick follow-up after this one. How would you sort of characterize Dr. Zucker's testimony hearing that you held? Not just in response to you, but in general.
Yeah, I mean, I think in general, whenever he was confronted with the tough question, he responded by saying, we're still in the middle of a pandemic. We're still dealing with this, but yet the governor is writing a book and taking multiple victory laps around this issue. So there's a clear disconnect, and I think they're making excuses that we're still in a challenging time when they don't want to answer questions, or they don't want to investigate. And when they want to move forward, they want to say, well, we learned our lessons, this is how we're going to move forward, and we're going to be tough together as New Yorkers. So there is an inconsistency in the way that they've conducted themselves, and that's precisely the reason why we feel compelled that an independent outside commission would do a better job. And not to mention, he didn't show up for the upstate hearing, neglecting my coworkers who had so many questions about the impact of the policies in upstate New York. And whenever we tried to bring it up at the hospital meeting, he was very tense, and he didn't want to answer anything related to nursing homes, saying that we spent hours litigating nursing homes. No, we didn't. No, we spent maybe 30 minutes diving into nursing homes, and we need another 30 hours to get to the truth. So overall, I felt disappointed by the answers, and I think we deserve a lot more.
Okay, the idea that you could even do an independent investigation, because he said nobody's really independent, would never be seen as really independent because you could never do that.
You know, the same thing happened in Europe with Boris Johnson, and New York Times called it a full-blown scandal. And there's already an independent human rights commission that was set in place back in May. So we're just looking for consistency here. You know, this isn't about what side of the aisle you are, what politics you are, because if you look at some of the covers, it's not just the New York Post or Fox News. We have very liberal, lefty publications that have come out very strong on this issue against the governor. So it ranges in terms of the criticism. And again, when it comes to the truth, there's only one truth that we're all trying to get to. And we can't get there if we can't get all the facts. So and it's easy to reduce everything to politics, and we don't want to tell the truth. And that's the narrative that they put forward. And we're here collectively from both sides of the aisle saying we're going to reject that narrative, and we're going to aggressively pursue the truth for the people of New York.
Thank you. So once you find the information, if this doesn't come along, what do you do with the data that you get? Do you do like the actual numbers? Is it to make legislation? Is it to kind of maybe file a civil suit, something like that? What's the end result like this?
Well, I think the end result is to follow new procedures or procedures that worked as the fall comes around, and this thing may rear its ugly head, or the next pandemic comes around. Look, without knowing after the 25th, when he shut down counting, we don't know when the peak of this took place. So knowing that, and knowing the actions that were taken before, during, his suggestion is, well, there was a lot more that took place before I did that 25th, so it couldn't have been that directive I did then. Well, we don't know that, and he's saying that, but we don't know that. And for Zucker, who's a learned man, and the commissioner of DOH, to come out with figures he doesn't have. He doesn't even have bogus figures because he didn't give us any figures to say, well, I absolve the governor basically because it was the workers who brought it in. I'm not saying some workers didn't bring it in there, but to say it had nothing to do with bringing in people who had the contagion lacks common sense. Like not letting loved ones in following CDC guidelines, but letting those in who have the contagion. Changing it on May 10th and saying you have to be tested and you can't go in. If you kept saying it didn't matter whether we sent them in because it didn't cause an explosion, why would you change the directive before? Say, it must have mattered. I'm not going to let you in now and I'm going to test you. So those are answers we need to develop a holistic plan for next time. We got to do it better next time.
Have you guys followed up with the hospitals? I know this came up with the hospital hearing regarding the number of nursing home residents that were brought into the hospitals and transferred out. Because weren't they saying that they would be able to produce those figures?
Yeah, they won't give those out to us. I don't know if you heard my question at that hospital situation. I asked Zucker, simple thing is call each hospital. They keep records of where the people come from and if they pass away. Ask them, give them a week, give them 5 days, each hospital. Go back to your records, tell me who succumbed to COVID after they came from a nursing home. I'll be calling you in 5 days. Now, supposedly during this whole process, they were in contact every single day. How many PPEs do you know? How many new cases? How many people died? But they can't get the number of people who came from a nursing home and died. They have staff, they're tracing all over the place. They could put 3 people in a room in 5 hours. They probably could call every hospital and say, I want that to 3 to 5 days. Add them up, and now we have the number. I'm not understanding this. You know, why is he not giving us that number? Is it an embarrassment? Look, we didn't sign up for this not to be embarrassed at sometimes. This is part of a job. We're embarrassed all the time by some of the things that happen out here. But when it's people's lives, it doesn't matter if you're embarrassed. You got to bring that out because it may make a difference in what we do following up if this rears its head again. So, yeah, that's a problem. Those are confined to, I think, DOH and some of the other organizations to get that information. They won't release that to us. Now, if any of the media has tried that, I would imagine you would start calling up you know, take 4 or 5 of you, add them all up to get, if they'll give them to you. I don't think they will give them to you.
Senator, Senator, there are both Democrats and Republicans in this room. How do you know there is enough support in the Assembly and in the Senate to get this bill across the finish line?
I never know if there's enough support. When I first put this bill out, I talked to some of the media people. They said, we're never going to get this done. You don't have any majority sponsors. Well, I have important majority sponsors here and the leaders of the majority of the Assembly. And, you know, some of these things are incremental. You have to put the pressure on. You have to use the bully pulpit. You have to build it up. But as I said, some of these things supersede politics and policies in politics because they make a difference in people's lives. All of different lives. Democrats, Republicans, progressives, Democratic Socialists, you know, the whole works. Independent people, liberals. And this is one of those issues. Nobody wants to see their loved one die. They want the answers to this because it affects all of us, no matter what your philosophy is.
And at a time when you say this all supersedes politics, there are many people who have said that if maybe there was some leadership in Washington, that New York would not have been put in this situation. Should there then be an investigation of the president's handling of coronavirus?
I think there should be an if we're not evaluating everybody who had leadership in this thing to find out what we could do better, we're negligent in our duty. So I think the president should have people evaluating the decisions he made, and others should be evaluating other decisions. But I'm in New York State, and I want to make sure the actions that took place here didn't damage my constituents. And I can't create a federal investigation. I can only help to create a statewide investigation. And again, not to place blame, but to get the answers, because the answers are what of supreme importance.
Senator, what sort of guarantee do you have that the governor would not necessarily meddle in a commission like this? There have been aspersions cast in the past that he tries to maybe shape the outcome of some of these commissions and their reports. What sort of safeguards should be in place for that?
Well, I don't want to get into the governor's mind or what he might do. That's a dangerous place to be. But often I've said with the governor, he's a very, very bright guy. He has more angles than a geometry book. So he kind of does get involved in things like that. But in this nonpartisan, bipartisan commission, there will be people from both sides. So if he tries to get involved to a great extent, I think he's going to be exposed. He's already been exposed in some of the other areas in terms of negotiations when they got a little bit close to him. But we want to concentrate on getting the answers. And I think at least we have to give it a try. If he tried to shut it down, it wouldn't be possible because it would be developed by us. He could veto the bill, maybe, but then we'd have to override him to do that. And I think if we pass this bill, I'm pretty sure we would override it to have that investigation go forward because we need these answers.
You mentioned that I hope you have the opportunity to bring it up to the floor for a vote. Do you have any idea about a time frame of when that might happen if you get that chance?
Yeah, time frames are difficult because we don't even know whenever we're in session, you know, because, and we're not really in session. You know, I had to do an amendment. That's the first time I got out of the Zoom office to go down there to make an amendment. It was in relationship to this. It was actually this bill, the outside investigation. So it would take some time, but this is so important and so timely. I would think they'd want to come back quickly and start the investigation because, as I mentioned, fall is coming. And the professionals in the field keep talking about, we don't know what happens in the fall with this. Other viruses has mutated, have changed, have sped up once again with the colder weather. We've had some beautiful warm weather. I can't tell you the number of swimming pools that are being built in my neighborhood right now, and I'm in a cul-de-sac. You know, I've been jumping over fences in the middle of the night because it's awful hot over there, and I don't have one, but not really. So we'd like to think it's the sooner the better because it's paramount. When you have people from both sides of the aisle calling for something, you know it's all their constituents which are in need, it's of concern for them.
And maybe also Assemblyman Kim and Burr's member, but can you speak to how, do you feel that there is that support? Could you have it to pass it?
Yeah, I mean, we plan on circulating our memo together representing downstate and upstate to our colleagues and try to get more sponsors. There's a longer step in the assembly. The senator knows we have more members, but Assemblymember Walsh is a sponsor as well. So once we get a certain number of sponsors, I think the leadership have no choice but to push this forward on the floor, and we plan on talking directly to leadership as well.
Yeah, I think that's normally how these bills go, is that, you try and get sponsorship. So that memo, we were just talking about it right now. We're going to circulate it as soon as possible. But to Senator Tedisco's point, we've been doing session via Zoom, so I think it wouldn't be too hard to actually get session back together to pass a bill, and maybe some other bills that are still out there that need to be. So it is entirely possible. Of course, the quickest way would be for the governor to do it himself, maybe by executive order, but that's probably not going to happen. But we have to take this route to try and pass the legislation and get it done in this route.
Yeah, let me say one other thing. I don't have any pride of authorship of this bill. I don't think Assemblyman Kim or any of us does. If they have a better way to do this, an independent, bipartisan investigation to get those answers, I'll sign up for that one. And I'm pretty sure my name's not going to be on the front of the bill in the New York Senate if it does come to the floor anyway. I'm just trying to expedite the process. I think it's a good concept. I think the bill's a good one. But if they have a better bill, so be it. Majorities take it. That happens all the time, and it's just the way of life here. Can't have a pride of authorship. So we just like to see the answers come forth and get it done.
Any other questions?
Thank you so much. Good job, guys. Thanks for being here.